Hi everyone, this is Dr. Arpi Sagar Lodha. So today, coming back to the short reel, the very important and the most common topic is fibroid uterus. So the most common question which keeps coming up is, why do we have fibroid, doctor? Why are they growing in size? Or what treatment can we take? So what are fibroids? So fibroids are basically non-cancerous benign tumors of the uterus, which is basically arising from the muscular layer of the uterus, which keeps growing in size or they might not grow. Now, why do fibroids come? So some people are at higher risk of getting fibroid uterus, like who has a history of early menarche, like periods coming in before 10 years of age, or there is family history of fibroid, which is more important. So it is basically genetic sometimes. Also, it could be because of the poor lifestyle, like increased intake of junk foods or dairy or processed foods, or low vitamin D3, low immunity, or more consumption of alcohol and smoking. So these are the major risk factors. Patients who have an imbalance of estrogen progesterones, means the estrogen content is high, which could lead to this fibroid uterus. Now, when to go to a doctor if you are diagnosed with a fibroid uterus? So usually the size of the fibroid, when it is below 3 centimeter, it is not as harmful, and usually we don't give any surgical treatment or medical management per se if the patient is not having symptom when the fibroid size is below 3 centimeter. But once it suddenly starts growing above 3 centimeter or above 5 centimeter, then we need to intervene either with medical management or with surgical management. We directly go to surgical management when the fibroid size is big or when it is causing trouble, like patient can come with heavy menstrual bleeding, pelvic pain, which doesn't go away with other remedies. There can be urinary issues or frequent urination, heavy bleeding during the cycles, and backache. So, and also there is abnormal growth of the stomach. So these are the common factors where we think about taking the surgery for fibroid. The surgery for fibroid is called as myomectomy. It can be a laparoscopic myomectomy or open myomectomy. Open myomectomy is very rare these days. We only do open myomectomy where there are multiple fibroids or if the size of the fibroid is very big, which could not be manipulated with the laparoscope. So these are the certain concerns. The other concern which comes up is that do fibroids are cancer? No, fibroid uterus is not cancerous.